Good evening, Madam Ministre, Monsieur Ministre, Mr. President, future Madam President of Alzheimer Europe, members of European Parliament, ladies and gentlemen. Thank you for inviting me and us as a Commission for this evening to open with you this important conference of Alzheimer Europe under so important title, as already Mars mentioned, Facing Dementia Together. I welcome this conference. I want to congratulate Alzheimer Europe, Luxembourgish government, and all other partners for this initiative. But I also express my thanks and my respect to those who are supporting today this event all around Europe, especially dementia patients and their families. Just last week, in my family, one of our relatives was diagnosed as Alzheimer patient, and it's trigger all kinds of questions around our family life, how we should change our family life, who is going to support, who is responsible, how to relate to the person. We live for years, and she is now losing her memory, and even the question, was she diagnosed properly? How are we doing this? So it's important that we see the numbers of Europeans. We estimate today 7.3 million Europeans are affected by different types of dementia. If consider fact that in most cases it's family and relatives who are carrying those patients, that we estimate today there are 19 million people in Europe experience the devastating consequence of dementia every day. They have the right to express answers, initiatives to help them. Current forecasts lead us to expand a doubling of number of persons affected by dementia in next 20 years. This is therefore not surprising. The European Parliament has adopted several resolutions on Alzheimer's disease, the earlier one in 1996, and next one 1998, and recently in 2009. This resolution underlined the health implication of the aging population and increase in number of people affected by Alzheimer's disease and other forms of dementia. The French presidency also placed special emphasis on the importance of this issue, and conclusions from the Council were adopted in December 2008. The Belgian presidency has also made dementia a priority during the ongoing presidency, and the important dementia aging conference will take place in Brussels in November 25th, 26. I am sure that useful debates during this conference and Belgian presidency work will provide useful contribution future discussion in the Council. From the Commission perspective, we also recognize the importance of the problem associated with dementia in the European Union. The white paper, our health strategy, Together for Health for 2008-2013, underline this and identify the better understanding of neurodegenerative disease such as Alzheimer as an important issue to be addressed. I am glad to be able to say the Commission has been acting for more than a decade to put in place action emphasizing the European dimension of dementias. Following this, the Commission has adopted in July 2009, a communication from the Commission to the European Parliament and Council of European Initiative on Alzheimer's disease and other dementia. The EU supports national efforts in 4 key areas: prevention, coordination of research, spreading best practices for treatment and care, and developing a common approach on ethical questions, issues like rights, autonomy, dignity of people with dementia. To implement this Commission communication, the joint action, Alzheimer Cooperative Evaluation in Europe, ALCOV, which already was mentioned by Minister of Health, was agreed, and the program will start soon. The project will focus on improvement of epidemiological data on Alzheimer's disease and other dementias, improvement of prevention, diagnosis, particularly early diagnostic, improvement of existing practices of care, both medical and social care, also practices in training, improvement of content, or the use of advanced declarations of practice assessing the competence of elderly people with cognitive impairments. The Commission has also adopted, April this year, the research initiative to tackle neurodegenerative diseases such as Alzheimer and Parkinson's diseases. We have allocated €2 million to this project. Under initiative of European Parliament, an interest group on carers, implemented by DG Employment of the European Commission, has been working from December 2019 to implement the Council conclusion which called for European Action Programme on Healthy and Dignified Aging. Carers and their issue will certainly feature in this action program. The need for better dialogue and cooperation between professional and informal care givers will be an important focus. The European Social Fund provides funding for training and trainers to be developed in coming years. Current discussions are going on designing 2012 as the European Year of Acting, Aging and Solidarity between generations. The Commission is considering to launch additional initiatives in the future Health and Acting, Aging Partnership. This should be known in coming days. The Pharma COC, the project coordinated by the Université de la Méditerranée Marseille France will create a new unique partnership between European Commission and European Federation of Pharmaceutical Industry and Associations. This project, co-funded by Innovative Medicine Initiative of European Union, which the quote is 9 million, and 30 million by industry partners, this is the most ambitious project tackling Alzheimer's disease ever funded at the European level in order to validate tools necessary to streamline Alzheimer's disease drug discovery and accelerate effective medicine to the patients. I would like to thank you very much, Alzheimer Europe, and the key platform of patient organization, the EU, for the excellent work in the last 20 years, and all your involvement in different projects through our health program and also other Commission programs. And I hope this work will continue. I don't think it's game is over. It's still years to come, and I hope this department, which is located in Luxembourg, will be always happy to help. And I would like to thank my colleague Tony Monserrat and Nick Fahy, who is running this C2 unit, which is taking care of this dossier in our department, for work and commitments to this project, and wish you good conference and good results, good thinking for future for all of us. Thank you very much.